Approve, Madam Chair.
Second.
Ms. Black, will you call for the vote, please?
McBride?
Yes.
Livingston?
have not reviewed them.
I'm sorry, we're talking to the council members. Ms. McBride?
I
just
thought
said
there
yes.
was a question.
That's someone else. Oh.
That's the clerk.
Barron?
Yes.
Newton?
Yes.
Livingston? Motion passed.
Our next order of business is the adoption of the agenda. Mr. Brown, do you have anything you'd like to add at this time?
No, Madam Chair, no addition to the agenda.
If there are no additions to the agenda, I'll take a motion to accept the agenda.
I move to adopt the agenda.
Second.
Ms. Black, if you will, please call for the vote.
McBride?
Yes.
Livingston?
Yeah.
Barron?
Yes.
Newton? Motion passed.
Now, in the part of our agenda, we're going to go through a couple of items that we are needing to discuss, and I'm going to, before I turn it over to Administrator Brown, the first order of business is to provide us with an update with ERAP 2. I would like to first commend Mr. Brown and his staff for the job that they've done with ERAP 1. We've gotten noted across the country for the excellent job that our staff have done in implementing this. Some of our staff members are actually going to be a part of a presentation with Department of Treasury. So I want to openly thank them for the job that they've done in implementing this, and we don't expect anything else but greatness from this Part 2 program. Mr.
Yes, ma'am, thank you. And just following up on that, certainly would be remiss if I did not thank Mike King, who's been a big driver behind this program, along with our government and community services persons who met with people in person to assist them with their process. But with that being said, what I wanted to point out with ERA 2, we have already actually the most up-to-date numbers approved over $2 million of the initial amount that we have received. And I told you in the last report that we had requested the additional 60%. The government, U.S. Treasury did approve Richland County to apply for that, and we have actually now received that. So not only did we expend all of our ERA 1 money, which was over $12 million, but we received our full allotment of our ERA 2 funding, which is going to total roughly about $9 million, and we've already approved $2 million of that. So in terms of the funding flow, that money is going out. We're moving with that, and we're still looking for additional opportunities that the committee had talked about in terms of outreach, in terms of getting more engagement with community partners who may be contacting citizens in the community. I understand recently there was a conversation about another group, I believe they're known as the Navigators, maybe associated with NAACP, but again, just trying to utilize, in addition to what we already have out there, more connections. So again, council members have additional resources that you're specifically aware of, that we can continue to get the message out that there is funding available. Then we still want to do that. We don't want anybody to stop applying, because we believe that we can get all this money out and then be eligible for more funding. So we want people to continue to apply for those funds. But that's what I have to add about ERA 2 at this point. And I'll stop there for any questions that you may have regarding that information.
Are there any questions or comments? Ms. Newton?
Thank you, Madam Chair. Mr. Brown, I just want to make sure that I'm keeping in mind the correct totals of the programs.
Okay.
Total allotment of emergency rental assistance that Richland County has/will receive, what is that number?
That would be a combination of 12.573 plus, I believe, 9.9.
Okay, so then ERA 1 was the approximately $12 million.
Correct.
And then ERA 2 is the $9+ million, of which we've already distributed $2 million.
That is correct.
Thank you. Thank you, Madam Chair.
Bryant, you recognize.
Yes, Madam Chair, I would like to direct this question to, Mr. Brown regarding the first part of the ERA funds.
Okay.
I would like to see, I guess you had to submit a report to Washington, or did you? A final report?
No, for ERA one funding?
Yes,
When you say you have to submit a report, tell me what you
How the
mean.
money was spent, did you have to submit a report?
We will ultimately have to submit a report to that, but we have weekly reports that we were submitting to this body. Yes, ma'am, go ahead.
So we finalized ERA one, right, in terms of the expenditure of funds?
Pretty much, yes, ma'am.
Yeah, I would like the report to determine where those funds went. And I know in the beginning, we insisted, the council, the committee, on keeping some demographic data.
Mhm.
I would like to have the breakdown of who received the funds and the amount, going to renters and going to the renting agency, because the breakdown was supposed to be maintained, and I would like to see that report. Do you have the final report, or when can?
Well, we were sending out weekly reports with the totals of that information, and we do still have that. I can certainly email that to you, and that information did take the breakdowns of by zip code, by race, by ethnicity, and all those demographics were in those reports, and we do have those reports, and I can definitely send you the finalized report for ERA 1.
Thank you. Just the final report. I don't need the final report, the
Sure.
summary.
Yes, ma'am.
Okay, thank you. Thank you.
No problem.
And Mr. Brown, it may be helpful for other council members who are outside of the committee to also receive that report, and you know, maybe even tomorrow, if possible, to share that with us as a part of your report when reporting out about the committee.
I can do that, and I actually was routinely putting that into the council packet. So, but absolutely no problem.
Thank you. Are there any further discussions in reference to ERAP 2 or 1?
As we look at ERAP 2, my question is, my understanding is that broadly speaking, we're following the same input and intake process as ERAP 1. If there were, obviously with the body, but if process a little data process, how would that process work if there was an interest in that?
Yeah, so we actually brought that through the committee and through council. So certainly, as long as those processes align with, obviously, Treasury, it'll go through the committee and through the council just like it did before.
Thank you.
Ms. Newton, did you have any recommendations?
I have, not that I'm ready to present formally, but I have had several conversations with people who are out in the community trying to fill this out, particularly those who are assisting the elderly. The impression that I have, and our staff has done a wonderful job at, answering questions, so this is by no means a criticism, that there are certain people who are computer savvy, have all of their documentation, the process is straightforward. There are other questions that people have about what type of documentation substantiates the kinds of claims that types of information. That's information, of course, has to be, et cetera. So this is the people. My 5 changes to the community. If there is understanding the process, I think there are some less technological, a little more difficult, you might hope. Not that it's the most cumbersome application process in the world, but again, for those people.
I'd like to add to that I think that our staff, as well as the library, and this is where we have a breakdown in communication as far as getting the information to the citizens. But if they are having challenges with the computer, we have in place where they can literally come and get assistance with the application process. So I think that we probably need to make that information readily available, maybe put that in the forefront. And really, as we put it in the forefront, even some type of, we don't need another, and this is my opinion, another tweet about it. You know, we need something that says, hey, maybe a staff member do us a brief video that says, if you're coming to an appointment to apply for these funds, this is what you bring. I think that we need to water down the process as much as possible so that the funds, we're doing a great job in getting it in the hands of people, but I can only imagine a number of people who have barriers in place that still are not getting the funds. So I'd like to ask you, Mr. Brown, if you and your team could do some type of brief video. They do a great job in posting on social media outlets and on our website this flyer that says, you know, how to apply. But we know that people are more drawn to pictures and videos. So if we can do something real simple to let people know what they need to bring and where they can go to get help as well, I think would be extremely helpful, because I've talked to many of the staff members who are actually doing the application with people. So we know that's there. Ms. Newton.
And to your point, and to everyone that's texted me about me not being picked up on the mic, if you can't hear me now, then text me again. I think that I've had some conversations with the staff at Richland Library, and based on, you know, some resources that they had and some conversations, they may have already created some of that we might want to share. And so certainly commend those efforts. I think that, again, some of the documents that people need to bring are not necessarily intuitive, and my understanding of the process is that in some cases the applicants themselves are having to create the documentation, because it's one thing to say, I need your Social Security card. That's really clear. I can bring my Social Security card. I can photocopy my Social Security card. But to say, I need proof that you have been negatively impacted by COVID, there is no one document that represents that. And so there's a lot of education, real education that needs to happen so that people understand what kinds of documents are applicable, how they might get or create those documents. So depending on who you are, your circumstance may be so straightforward, but it might not be for everyone. So again, I didn't mean to necessarily take us down that path. I wanted to understand. But we do have, again, our staff is working. I just want to acknowledge really hard. Anytime I've gotten a question, our staff has answered it. I know that they're taking great phone calls, but I just think I would love for me to just take a look at that process again in a way that I couldn't have before, to see if there's anything else we can do to just comply in an even simpler way. Thank you, Madam Chair. I'm really done now.
McBride.
I find the question, and I do appreciate the work of staff in getting the funds expended. Again, as I've mentioned numerous times, there's a time element for emergency funds and getting the funding in hand of the people in time. And so that has always been an issue of mine and remains an issue. And I know that this was a new process for everyone, and we've learned. So as a result of the first process, have we learned anything differently about turning around the response any quicker and getting the funds in the hands of those that need it?
Yes, ma'am. I would say, in short, yes, ma'am. Does it mean that it's perfected and we can't learn anymore? No. But we have had internal conversations where we have internally changed some of the processes, specifically dealing with information flow from departments from approval to payment. So yes, ma'am, we have learned from some of those first distributions and worked to improve that in our second distributions. But again, we're certainly open to information, because U.S. Treasury has been all about that, looking at programs that are being successful and what can we take from those programs to help our programs that are not doing well, which is not a Richland County program. We are doing well. But even programs that are doing well, what can we still learn from others? So absolutely, we can still learn, and we're willing to do that and apply any opportunities we can to simplify the process to make the funds more available quicker for citizens.
Yes, and I realize on the national level and local level, in terms of expending the funds, Richland County is doing extremely well. It's still a major issue in terms of getting the funds out in a timely manner, both locally and nationally. So the faster we can get the funds into the hands of individuals that are in need, I think would be a great asset to all. So again, I thank the staff for the work that has been done, but to keep in mind that these are emergency funds, and we need to get them out as quickly as possible. Thank you.
Mr. Brown,
Yes, ma'am.
the average time in, let's say an ideal application, and none of which are ideal because they all have different situations, but on average, what is the turnaround time from an applicant applying and an applicant, or I'll say, because we can't control what happens after it leaves our building, but an applicant applying who has the necessary documentation and a check being cut?
Yeah, and I think what you're asking is a big issue that people fall down on. Is what you're asking me is a completed application, to Ms. Newton's point, that has all of the necessary documentation. So when a person hits that button and it is reviewed, what is the time that it takes for that to happen to the time a check is cut? So what you probably have is easily, I would say, that what I would feel comfortable saying right now is somewhere between 5 to 7 days from a completed application that is submitted, that is reviewed, and then the time that goes to processing, and then you're talking about because they process these on a daily basis. We don't do batches, so that's something else. We don't do batches, so you're talking about easily, I would say, a solid week. So I would say that's a reasonable time frame from a completed application to the time it has been vetted and approved for payment. So then, of course, payroll cuts a check. That check then goes out through the mail. We've kind of worked on that process a little bit because I know people don't want to hear this, but unfortunately, the U.S. Postal Service hasn't been very effective right now. I'm not blaming anything on them. I'm just saying we found that out during this process. So we've been trying to figure out how to get the money in the hands after it's been approved, because sometimes it's literally we've mailed the check and the person hasn't received it, and it's been several days since that time frame. So we tried to work on that. We've delivered checks to utility companies. We put checks in the hands of citizens. So this is something that we're working on because we recognize that it's an issue. So I would say that, sorry, I was looking at some information here trying to get my data correct, but that's the process, and that's what we're looking at, how to slow down or increase the time the speed from the time it's approved to the time it gets into their hands, because that's where the real breakdown has happened. But some of that is really not a Richland County controlled thing unless we start literally putting checks in people's hands, which we have. Again, delivering to electric companies, water companies, the city of Columbia, and to citizens. But realistically, we can't hand deliver to thousands of people. We don't have that resource. But we've been trying to be creative in how we respond to that.
I have a quick follow-up question. Aaron, as in the beginning, and that's great news for me to hear that it takes approximately 7 days, because I'm going on from, that's why I asked you what progress has been made, because initially I know that it was taking 30 to 60 days, in some cases a month or so, for people to get their resources, and that was in the beginning. So that's why my question was framed that way, in terms of what was learned from the initial process to now. And knowing that you have improved the process and the turnaround time is very good. So thank you.
Yes, ma'am. And we'll continue to work on that. And that really depends on the completed application, not a submitted application, because those are not the same things.
And I do believe that once we continue to get information in the hands of the citizens, then as to what is needed, what is actually needed for them initially, then I would like to say that those applications that are completed on the first round, the objective is to shrink that number. Mm-hmm. And I think that just helping them know what they need is critically important. So to move forward, the mask ordinance.
Yes, ma'am.
Mr. Brown, if you want to start off here.
Well, I know there's been lots of conversation, not really just only in our state, really throughout the country, related to mask ordinance. And when I knew this question would come up, one of the things that I've been reporting on and consistently since we got into COVID-19 was the numbers that were metrics that were used to highlight the spread of COVID-19 in the community. So that was the 5% number you heard about so much, the percent positivity rate. If the number was above 5, it indicated that there was spread. If it was below 5, it indicated that there was a slowing of activity. So I've been reporting out that Richland County has been above that 5% for quite some time now. In addition to that, we talked about previously when Richland County put a mask ordinance in place, at that time, your percent positive and your number of confirmed cases per 100,000 were, in some respects, substantially lower than they are now. And I reported that out at the last meeting just to give you an idea that in July, when the council, before it went into its recess, we talked about we were in a moderate tier, and we had just ticked up from the low tier. And that moderate number was 58 per 100,000. There was 58 cases per 100,000 coronavirus tests that were confirmed cases. At the last meeting, I reported out that we had gone up to 925 confirmed cases per 100,000. And you will see in the documentation that I submitted to you for your agenda packet for the council meeting that that number is now at 1,014 confirmed positive cases per 100,000. So that number is not going down, that number is going up. And I just say that to you because when we first instituted a mask mandate as Richland County, the numbers were nowhere near as high as they are now as it relates to the confirmed cases per 100,000. So I would just submit that to you and to your consideration. If you look at the history of documents I've submitted related to COVID-19, you can track that. So it's not something that we have to guess on. The reality of it is, unfortunately, the cases have continued to climb. And the last thing I'll say about that, Chair Barron, is when we were reporting on COVID-19 kind of in the first wave, and what I mean by that, I'm going back to 2020. At that time, our high numbers were like, man, when we hit triple digits and it was like 180, 185, we were like, oh my goodness, that was considered extremely high for us. I can't tell you right now the last time we've been below 200 cases per day. So we're looking at 200 and 300 plus cases per day. So again, just relative to that, that's just information and looking at what we did before. And of course, we didn't have a vaccine then, but that's what we did before the mask ordinance, and that's kind of where we stand now. So that's the data related to COVID-19 in our community. And again, all that data was reported via DHEC, so that's where I'm getting my sources from, and I generally cite that when I send you that documentation.
At this time, I'm going to open for any comment or discussion from the committee in reference to the mask ordinance. Ms. Newton.
Thank you. This is related in general. Thank you, Mr. Brown, for sharing that information. And I guess maybe this is actually for my colleagues. I think that one thing that would be helpful for me as we navigate COVID is if we were able to, have a conversation, whether it was with Dr. Linda Bell, or I know at one point we had someone who came in from Prisma. I feel like I have enough information now to vote on the mask mandate, but just some sort of regular update. I know, for instance, I recently read an article in a national publication where a doctor had said that you are more likely to get COVID in South Carolina as a vaccinated person than you are as an unvaccinated person in New York City, just because the rates of COVID that we have are so much higher. That's the kind of information, it's a credible source, it's a doctor, et cetera, but that I would love to be able to run that by someone who is not just a doctor and medical expert, but someone who's well-versed locally here. So again, I feel like the case for me at least is made for a local mandate now, but if there was a mechanism, whether it's our regular county council meeting or our coronavirus ad hoc committee meeting, or whether it's some other forum altogether, I would just love to have that forum where we can ask those additional questions. Mr. Brown does an admirable job pulling that information down from DHEC, but at some point, unless you've got an epidemiology degree that was not previously disclosed, you might not be able to answer some of the questions we might have. So I offer that.
I think that's definitely noted. It would be, I noticed that we are getting email updates from Prisma. I'm starting to see those emails come forward, but it would be great to further strengthen your report, Mr. Brown, to have someone either on hand or that can answer any questions that we may have specifically to COVID, as it seems as though South Carolina has definitely been identified as one of the hot spots in our country. Any of my other colleagues, Mr. Livingston, I think you wanted.
Just to say, just want to remind my colleagues, this item will be on our agenda on a regular council meeting tomorrow. You have a tentative draft of a ordinance. I just think it's important for us to just look at that prior to tomorrow in terms of what it says about penalties, commercial establishments, people with health issues, fines, and all those things. And so we'd be prepared to address this issue tomorrow.
Livingston. Right.
Madam Chair, is this the opportunity to talk about other issues or particular activities or programs that we can implement, or is that someplace on the agenda? Because I don't have the agenda right for it.
Have some outreach. We have outreach on the agenda.
Okay.
A little bit later.
Item 7, yeah.
Okay, I didn't have that right before.
Ms. Black, can you make sure that Ms. McBride gets an agenda, please? So to that point, you know, Mr. Livingston, I know that this is an agenda item that we do have to cover tomorrow, but I would just like to encourage everyone, all my colleagues that may even be online, that to definitely let's take this seriously, because one of the things that hit home for me when having a briefing with Mr. Brown was the reality of our numbers are extremely high, and it's based on your report, Mr. Brown, they're almost 100% higher than when we've had a mass ordinance in place before. And so if we put a mass ordinance in place before with 185 count cases, and now you're reporting that we have 1,014, we definitely want to look at this real close. Any further discussion on this item?
I have my hand up. I'm
If-
not sure if anyone can hear me or see me. This is Coroner Rutherford.
Yes, ma'am. You may be
Okay.
recognized.
Thank you so much. So I would just like to say that the coroner's office is receiving all of these cases that die. And I had reached out to the public information office about potentially doing a PSA to kind of show just how many cases we're seeing and how many deaths, and to try to put a visualization to it, because maybe if people could see that, they would see that this is not just like a hoax. I mean, I don't know that people think that anymore, but I think people are very relaxed in wearing their mask, washing their hands, being diligent about keeping their mask on when in public places. They're standing closer than they should. But if there's a way that we could maybe do some sort of visualization of, like, maybe even just stacking up the cases so people can see the number that we've had, because it's pretty sad that we have this number in South Carolina, just on the coroner side. So I would love to partner with anyone on this call to see if there's something that we could do to try to put a visualization to it. But also, we are not receiving every COVID case that dies. And so maybe you guys know the folks at the hospitals who could maybe call us and let us know, because we asked, the coroner's office has asked to be notified of all the COVID deaths so that, one, we can protect our staff, because we're the ones going out into these homes and we don't know people's status. Sometimes we get there and families don't tell us. They just say, oh, grandmother has died. And we find out later, and we've had 8 people in our office with COVID. So, and our staff members with COVID. So we are trying to do contact tracing just for our own staff. So if you guys know people at the hospitals, can you please just remind them to please let us know when there's a COVID case so that we can protect ourselves and and the people that we serve. That's all.
Thank you, Madam Coroner. I would like to just address this briefly, as we somewhat have broken the protocol for our meeting. But I would want to just say that we are having an item that we will discuss as it relates to community outreach, and one of which is what we're calling the infomercial. So hopefully we can look at the creative ways that we can do to address this issue, that in getting the information out to our citizens of Richland County and its severity. With our next item for discussion, it is the COVID-19 vaccine mandate for county staff. Mr. Brown?
Certainly, Madam Chair. This has been an item that recently you've seen at least a couple of cities, maybe a county, taking this step. I will tell you that during our regular department meetings on Wednesday mornings, I've talked about this item now for, I guess, going on almost 2 months. Having departments start considering, the potential reality if COVID-19 continues to be so prevalent in our communities, that this is something that they might start seeing. We talked about early on in the pandemic whether or not something like this could be possible, whether organizations have the ability to do this. And over time, if you don't know, over time, what you have seen come out is you've seen the Equal Employment Opportunity Commission come out and talk about employers having the ability to make a call like this. You've seen the Occupational Safety Health Administration, which is OSHA, who agencies like ours have to report to, that they've added to their suggested guidance to fight COVID-19, this idea of vaccinations. And so there's a lot of information out there from healthcare providers, public health experts about vaccines and their effectiveness, and encouraging, and now you're starting to see people go from just encouraging in the form of asking to now some folks actually mandating. We certainly saw it in the private sector, and now you're seeing it some in the public sector. So unfortunately, Richland County is not immune to the effects of COVID. And as we just talked about our numbers, we have very high numbers. So these are things that I think I certainly want to hear from the council. What do you want the experience of your customers to be, your customers as it relates to both people who serve the citizens of Richland County as well as citizens of Richland County, in terms of just them being the citizens in which you have charge over. So this vaccine, from a mandate perspective, is certainly a big deal. I think it certainly warrants conversation, and I didn't want anybody to think that this is something that will be made in a closed room without discussion and consideration, because this is a big deal and it affects a lot of people, and certainly wanted to have an opportunity to hear from this body as well as your colleagues on just really what you want your customer experience to be as it relates to the citizens of Richland County and the staff that serve them.
Before I open it up to my colleagues, Mr. Brown, as we heard on Friday, the president did put out some mandates as it relates to vaccines. How does that play, or does that play a role in county government?
Yeah, I'll have to, I hadn't gone out and dug into what the president has communicated to see how that would impact us. I don't know if he said anything about federal funding at this point, because one of the things we talked about was the ARP money, and that money is basically money that comes from the federal government. And if the federal government adds, attachments to it for folks that would use it, then certainly that could apply to us. So I don't know if that's happened. I don't want to speak to that and say that's the case, but those are also considerations that we've been thinking about as, what happens if and when we spend these funds and that becomes, a condition. And I don't know that that's happened. I'm not saying anybody that's happened, but those are some of the considerations that we have considered, Ms. Barron.
I think that it would definitely behoove us to see how this mandate impacts us, and and to move sooner than later to look at how we should, if we are to comply, and if we are, then how do we move forward with it? I know there's conversation. The governor has joined a list of other individuals that are planning to fight this. But I do think that in order for council to be able to make a decision or to even give you any guidance, we need to know how what the president has done with his mandate, how that impacts us, and which side do we really need to be on, so that we can really move forward with making an informed decision about whether this is a mandate that we want to put on our employees. I'll open it up for any of my colleagues. Mr. Livingston.
Brown, for me, what would be helpful is for us to look at something similar to what the University of South Carolina is doing as it relates to, I think they're doing, requiring vaccinations or 2-week testing. Just to look at stuff like that and tell me what would be the implications if the county were to do something like that, what's the legality as it relates to the county doing that, and a little bit about the enforcement. Not now, but just if that comes up, I'd like to just look at that and see what that looks like for the county staff.
Yes, sir.
Thank you, Brown. I guess, at some point, to what Mr. Livingston is saying, there would have to be some proposed policies and procedures that accompany that. And then one of the questions that I have, just tracking what other companies are doing, is it also involves protected health information and that type of thing, and how we store it, how we treat it. And so that is something that I would also like to make sure is addressed as well.
Yes, ma'am.
Brad, did you?
I'll just add, I think I've already emailed everybody on my feelings regarding it. I like the idea of the vaccination being mandated, but also those who don't want to take it, then they would have the option of being tested. I would like to look at the legal issues also, and also to look at some programs that have some counties that have already tried this and how successful that they have been, and get some feedback from them. I'm really more interested from a national perspective than I am from the governor's perspective. Thank you.
Mr. Brown, did you have anything you'd like to add on the vaccine mandate?
I think as we look at it and consider it, one of the things that we'll talk about is, if we get to that point, is some sort of metric, like we did with percent positive numbers, and like we do with the case counts, that speak to some level of effectiveness. And, certainly it would not want to be arbitrary in that. And my thought would be that just like we follow the percent positive number issued by CDC, that we would look at the 70% number as a number that would be an effective number to reach in terms of what they were terming as herd immunity. So I know we're not that far, but as we talk about and look down and looking at actually doing this, to me that would be something that we would use as a target metric if that was something that we did, consistent with what's been put out there about herd immunity related to the vaccine.
And Ms. Newton, before you go, I'd just like to add to that I look at this, whether it's the mask mandate or the vaccine mandate, I look at it just like Ms. McBride said it earlier when we were talking about ERAP funds. This is an emergency. That we're in a health crisis. So as we look to address these items, I would like for us to move quickly on our research and move to see how we can, as Richland County, do our part to slow the spread of COVID-19, whether it's through a mask ordinance or vaccine mandates. How can we what role do we play in slowing the spread? Ms. Newton.
Thank you, Madam Chair. You've all said it, but just very quickly, I wanted to reiterate again that what we are talking about right now is exploring the possibility of a mask mandate for county employees and county employees only. And the reason that I say that is because I know that all of us are getting 15 million emails a day from people who are asking about general population vaccine mandates, which as far as I know, we don't have the authority to do. So for clarity's sake, just one more time, we are speaking about those employees employed by Richland County. Just want to slow the spread of COVID and want to slow the spread of those emails about areas that we're not actually pursuing. So.
Very well stated. This is not a vaccine passport. This is for our employees. Thank you for hitting that ball right out the park. If nothing further on that, let's shift gears to item number 7 on our agenda, which is community outreach and awareness efforts. Before I turn it over to Mr. Brown, I think this is one thing that Ms. McBride has championed so very well, and it is still, whether it's we're talking about funds, us getting into the funds into the hands of our citizens, or just incentive programs to get people vaccinated, we need to be creative in playing our role. And so Mr. Brown and Ms. Thomas and I, we had a very creative and colorful conversation as we explored some options. And hopefully even today, I'm hoping that this body will be able to even provide some insight to give Mr. Brown and his team to trudge forward. Mr. Brown.
Yeah, absolutely. Key related to these particular incentive programs is to understand that the funding that we're talking about is potentially using American Rescue Plan dollars. So when we talk about that, if you recall, that's something from a general perspective comes at the approval of council. So it's going to be real important that for us to understand and get feedback on the things that you believe are acceptable practices or the things that you would like to see in utilizing these funds, specifically because those fund uses are approved by ultimately county council. And we've heard a lot of things out there. Maybe if you've seen news reports or just watched TV, anything from individuals being incentivized through things such as you've seen states do raffles. I'm not saying that's what we're doing. I'm just talking about things that you've seen. You've seen states do raffles. You've seen employers do like what we've done. And in case anyone doesn't know, if an employee wants to get the vaccine, the employee gets time off. If an employee needs to recover from the vaccine, the employee gets time off. If the employee is exposed to COVID, the employee gets time off. We have made it, at least from a financial standpoint, we have incentivized people not to come to work and bring COVID just because they're concerned about not having a job because they get sick. And we've incentivized people that if you want to get the vaccine, and we've talked about getting the vaccine, and we've encouraged you to do it, and we put our money colloquially where our mouth is in the form of paid time off. So I want you to be aware that we've done that internally for our staff. Could we do more? That's a conversation we can have today. What kind of additional things would you think that you would like to see? We've heard just recently the city of Columbia, as an example, talking about giving $500, incentivizing their staff to get vaccinated. You've heard, other agencies look at, how they engage the community in incentivizing the community to get vaccinated. So there are a lot of different things out there. And right now, I don't know what's out of bounds in terms of creativity because this pandemic is just fully something that we don't all have our hands around. So I think as we have this discussion, we're certainly looking for ideas that we can do. We already have in our healthcare program an incentive that if you get vaccinated, that goes towards points that reduces your insurance premium. So we have that. Do we want to add some additional value to that? We can do that. So again, there's a number of things that maybe I'm not even thinking about that you have heard that you're wondering, has Richland County thought about this and let's explore it. And that's what I would like to do now. So we'd definitely love to hear, Ms. Barron, from you and members of the committee concerning this particular area of outreach.
Open it up for any ideas for incentives, whether it's for our staff or for the community as a whole. Ms. McBride.
And I would like to to thank you. I think you've done an outstanding job in terms of incentivizing staff, and I know we'll continue to look to do even more things. My concern was with the community, with the escalating numbers of COVID cases now, and particularly in some of our vulnerable communities. I'm database driven, and I'm not sure at one time we knew where most of the COVID cases exist, or the percentages, because DHEC at one time used to give us that information. I don't know whether it's available now or not, but we do know that there is a large percentage of COVID in our communities. And there are those that have not been vaccinated yet, and for whatever reason, they have not been vaccinated. And so I know that other counties and different places, they've tried this program, monetary incentives, and it has worked in terms of getting numbers. And my proposal would be to look at doing, not constantly, 1 or 2 or 3 events with an extended period of time, maybe for a day or 2 days, at certain locations, trying to get those hard-to-reach citizens that need that extra push to go on and get the vaccination. And it's not, the vaccination is for them. We're not rewarding them for being vaccinated. It is for the safety of everybody, not just them. This is a neighborhood, a person-to-person safety. And with COVID escalating like it is, and our poor kids that are getting sick and dying for it, I think we need to use everything possible to help stop the spread. That's my position on the program for the community.
Ms. McBride, I want to follow up and just ask you a little bit more questions, because this is somewhat of a brainstorm at this point. You started to talk about a vaccine, I guess, location where we would actually be have one of our healthcare providers set up and have vaccines readily available. Let's think through a little bit more about when the citizens come to get the vaccine. Are we looking to say, if you come and get this vaccine, then we're going to put you in a pool to possibly receive something, or do they automatically receive something just for coming?
Well, this is the programs that I've seen, and what I was thinking about. We're getting ready to, in District 3, I'm working with the Meeting Place to do a big health push on education as well as vaccinations, working with the Health Department and the University of South Carolina, a number of partners. So they will be given, they will have a mobile vaccination, mobile truck there to vaccinate individuals. Now, if we do the incentive with them, those who have not been vaccinated to come in, they can get their shot immediately, and then there'll be a way for them to get the incentive. Now, all the logistics of that, I haven't worked, many programs have done it, so it's easier to figure out how you do it. I think the city gave away a debit card. So that would be something that you would have to work through the logistics, but you would be vaccinated at that time with an incentive. Now, the next time if you want to come back for a second, that's another process, but it would not be going on forever. It would be a certain event that it takes place.
Okay, so I'm just further taking this a little bit further. We know that 2 of the vaccines take 2 shots. So with that, would we want to hold the incentive for shot number 2?
No, you give the incentive for the first shot,
Mm-hmm.
and then if you come back for the second shot, there'll be a date for another incentive for the second shot. Mm-hmm. It's 2-part, yeah. And not to mention that they could still go get their second one anytime because the vaccination places are open everywhere. Mm-hmm.
So, Mr. Brown, is there any is something like a gift card, a gas card, some type of debit card, is that an allowable cost for with these funds?
I know that we can have incentives specific to the promotion of, so you got prevention, you got mitigation, and recovery and response to COVID. So in that respect, the answer is yes. And I think that the parameters of the program, I hear Ms. McBride talking about, are parameters that could be set. I can tell you I've had a number of individuals, because people, when you're in this role, you get a lot, right? And so one of the things, I know we hadn't talked about it yet, and we may be getting around to it, and we may not, but individuals have said, you know, basically, what about me? I took these steps to get vaccinated, and, you know, you want to incentivize folks to get vaccinated, and I've done that. So what about me? And so that, again, as we talk about these things, that's some of the conversation that I'm wanting to hear from, because, I mean, those are the kind of questions that I get related to, you know, folks being encouraged to get vaccinated and being incentivized to do such. So is this something that would only be going forward, or would it be something that's retro, or, you know, those are the types of things that would have to be addressed by the program as well?
It's not retro. It's moving forward. Those people that have not been vaccinated, the ones that were vaccinated, knew they wanted to save their lives and the lives of others. The others have not been vaccinated for whatever reason. I'm talking about vaccinating them so they can help save the lives of others to keep from spreading the disease. So that's what that's about. And there are a number of programs that we could get all the resources and the information that they've tried to get that from them. I know the president even encourages whatever we can do to stop the spread. I'm glad that those people we have been vaccinated. We're not worried about those. We're talking about the unvaccinated, who is causing all the hospitals to be full, who's causing all the problems, those who have not been vaccinated.
Thank you, Ms. McBride. Any further input for this brainstorm here, Ms. Newton?
I guess I'm just curious. I don't want to bring anything that's not properly before us. So the title is Community Outreach and Awareness Efforts. There are only two things that are listed below, the incentive program and the infomercial. And so I guess I'm wondering, is this also an opportunity for us to speak about other things, or are we limited to these two items here that are listed?
Oh, absolutely. We broadly, put this here. So if there are any other ideas that fall in that category, these are the two items that we have that we knew that we wanted to address. But definitely, if there is another idea that you have that you would like to add to the body, please share.
Well, sure, and I am missing some data to know if this is how helpful this would be or not. But I really do wonder, as we look at efforts that we're making to try to increase vaccination rates, if it might make sense for us to look at additional vaccination clinics and or testing clinics, et cetera. I know that they still exist. Over the weekend, I wanted to just take a COVID test just to follow the regular protocol, and I was like, I don't actually know where I can get a COVID test, so I had to, go Google, and the DHEC website was helpful, and find a place. But there's so many multiple reasons why people are not being vaccinated that we want to make sure we provide opportunities and carrots on both sides. So again, I don't know what the final data was with the last vaccination clinic that we did out at Columbia Mall, for example, understanding that that was in partnership with some other groups. But is this a time when we want to take a look at offering that again? Is it, for example, I don't know what the logistics are that are required. I don't know how many people come to visit the county offices every day. Do we want to have people be able to get, vaccinated right here, pay your property taxes, get vaccinated? I have no idea. But what additional opportunities do we have to provide access to testing, to vaccines, to masks, to whatever those things are? I know that several of us here, had successful mask giveaways. I thought I was done and donated my leftover mask to the detention center, and now it looks like maybe I should have held on to them. But what other things can we do to provide that access? And again, if I knew more, a little bit to Ms. McBride's earlier question, where are the areas that are greatest hit? How many people are coming here to the county every day, or how many people went to the vaccination clinics that we had at Columbia Mall? But I really want us to look at providing those opportunities as well. Thank you, Madam Chair.
Livingston.
Some of the literature regarding vaccination is centered around, folks feeling comfortable with individuals that they know in their community. And I was wondering whether or not we've attempted to engage our county council advisory committee, that group of neighborhood folks, community leaders, and we engaged them and brought them together and said, here's some things that y'all can do to help us and so forth. I think stuff like that could be very helpful.
Hey, Mr. Livingston, thank you. I was not aware of a county council advisory committee.
Well, not advisory, it's council of neighborhoods.
Okay.
And I guess, Mr. Brown, Mr. Livingston raised a good point as we're looking at our outreach, and I know everyone is looking at all the things that they can do, but to the point of trusted advisors, I have no idea. Maybe if we're looking at doing a vaccination clinic, maybe we need to be looking at how can we partner with our local associations for medical professionals. Maybe it's not just, Richland County or whomever is hosting a vaccination clinic, but maybe it's your doctor, Dr. John Smith, is going to be at this clinic, and your doctor, whatever else we can do, just again to really encourage and provide access. And to Mr. Livingston's point, maybe we're not connecting enough with some of those trusted advisors. I mean, maybe we need to camp out outside of a busy barber shop. I don't care where we need to go, as long as we can connect with people and help.
It sounds like what I'm hearing is that we are exploring opportunities for us to do our part in mitigating or slowing the spread of COVID by, I think Ms. Newton put it best, with the mask, the testing, and the vaccine. I think if we can look at finding those zip codes in our county that are hardest hit, and then find those trusted people, whether it is a church or there could be a hot civic group within that community, and then looking to host several events throughout those community and those areas, and then attaching some type of incentive for getting that shot or coming to get tested. I think that's how we attach those individuals who have already gotten their COVID shot. Well, they've already said that just because you have your COVID vaccination, you still need to be tested regularly. So as we test regularly, maybe you bring your vaccine card, you bring your card, and then you come get tested, then we can attach perhaps an incentive there. But because it's not enough for us to get the vaccine. We know, as we talk about children, I work with children, and I can't put on enough masks when I interact with them, because even though I have a vaccine, I could very well have COVID and then spread it to this child who is not protected at all. So I think that we do a three-prong kind of event. The number of events, we'll defer to you on that, Mr. Brown, but I think that what I'm hearing the committee say is that we definitely want to address those three areas, and then looking at the higher cases in the particular zip codes throughout the county. Does that provide you some guidance?
Yes, ma'am. Yes, ma'am, it does.
Great. Anything further on this item? If not, we'll move to 7B, which
Hello?
is our infomercial. And so with that, we would like to talk, Mr. Brown will allow you to speak on this, but we just kind of been brainstorming how can we get information out to our citizens to encourage them to be able to have information and know, okay, this is your councilwoman saying, we want you to get a vaccine, or what pros and cons and things but taking a different approach on that. I saw a very, one that was very impactful. Several coaches right before the football game, they had a commercial where they were encouraging people to get vaccinated. And I think that we should definitely look at an opportunity of that magnitude as well. Mr. Brown.
Yes, ma'am. Before we move on, I just want you to know, you have a hand up on the Zoom meeting. It looks like you have, so just didn't know if you saw that.
I do see it, and I broke somewhat of protocol earlier, but we do not traditionally take
Reference that, just work what we've done. If it is someone who is a county elected official or a staff member who has something to share, they're not allowed
Okay,
to share
very
that.
good.
It's just not the public input.
Very good. Thank you so much, Mr. Chair. So to that, Coroner Rutherford, you may address the body at this time.
Thank you so much. I was sharing that I am meeting with a company tomorrow that is looking to bring mobile trucks here to Columbia. I've been in talks with them. They're actually coming here tomorrow for me to kind of show them some areas that we have seen from the coroner's office perspective that seem to be, that have a higher number of cases rather. And so they are willing to come and do free testing. They have some sort of federal grant. And so they need to get the vaccines done. And so they are looking for cities that have a greater need. And I certainly think that Richland County meets that need and meets that requirement. And so they are willing to come and station their trucks around Richland County in some of these underserved areas or where transportation may be an issue. I recognize District 80, areas near 29203, 29223, and I believe it's 29016, that like a Blythewood area where transportation is a little bit more limited. And so they're actually coming here tomorrow and I'm going to show them some different things. And so this is just something from the coroner's office perspective that I've been working on to try to bring that here because it's free. I believe they give them some sort of gift card when they come. And this would be not a drain on county resources. It would be something that would be brought in to the county. So it's just a thought if you guys are interested, but we are looking from the coroner's perspective to try to prevent deaths to bring this company in. Thank you so much.
Well, thank you. And I think that it's noted to have this information, and we definitely welcome an update to council, Madam Coroner, as well as we are going to continue, I think as many doses that we can get out in our community, the better. And so as we look at the creative ways of collaboration, we definitely will look forward to hearing back from you as we continue to move forward with also some additional opportunities for the citizens here. So thank you so much for sharing that. Mr. Brown, we're going to go back to 7A, item 7A at this time.
Yes, ma'am. 7A or 7B?
I'm sorry, 7B. Please forgive me.
Yes, ma'am. So in our conversations, one of the things that I thought is that you kind of talked about this as a group so far, but this idea of, what is Richland County's contribution to helping slow the spread of COVID-19? And so certainly there are some things that we've tried to do as Richland County government, but I thought, how about we continue to try to work as Richland County as a community of organizations and not so much as Richland County as the government. So what I thought about is, how impactful would it be if, for example, each of you who have respective city council persons and state reps that represent similar areas, if we have an infomercial, for those coverage areas where we all are together, talking about getting vaccinated. What if myself as a county administrator, along with all of the other city managers and city administrators within Richland County, did the same thing? And then you move that on to, instead of it being about, Prisma or MUSC or Providence, what if we have collective health partners, saying that? So again, this idea of Richland County as a community of organizations supporting these steps for community improved health and quality of life, rather than it be so much, a quote-unquote Richland County thing as a government, but it's Richland County, again, as a community, more so than it is Richland County as a government. So, again, bringing those partners together that have this similar idea of quality of life and improved health outcomes, and us partnering and having these various infomercials that we would do to get that message out. So that's kind of the idea that I was tossing out there, Ms. Barron. I don't know if it's good or if it's bad. I just thought, again, it would be an opportunity for us to show a unified understanding of community rather than my view of community versus somebody else's view of community. So I just throw that out for consideration to the body.
So I'll open it up for any of my colleagues that would like to comment on Mr. Brown's idea of this infomercial.
I think it's, Madam Chair, I like the idea of joining with our other partners, other elected officials. I think it's a good idea.
Ms. Newton.
I was just thinking thoughts in my head, maybe really loudly. No, I mean, I think it's great. I think that anything that we can do, I would love to see us do it. Obviously, we're talking about a specific tactic, which is an infomercial, and you can do the very best infomercial in the world, but if the thought hasn't gone to it in advance in terms of how you're going to distribute it and make it seen, then it doesn't really achieve anything. So I'm all on board. I would just like to make sure that before we invest the effort, that the actual distribution plan in terms of how is this thing that we do going to reach the people that need to see it, to make sure that happens first, because that's what it's all about. It's about how can we meet the people where they are. And so at this point, if it's a carrier pigeon, I mean, I'll do that. So whatever we can do, I'm open.
Ms. McBride.
I would just like to add that, and I don't know where I read it, is that we have the different stars coming out encouraging vaccinations and all. But they're saying that that's not as effective as actually having regular citizen, laypersons come out and talk about the experience they're finding that, and talking to the people that they trust, people that the other citizens trust, has been proven to be very effective, or more effective.
I think that's a part of Richland County. So if we are talking about the infomercial and looking at Richland County as a community, then it would have to engage our local leaders and people that everyday face. I love the idea. I am concerned about, as Ms. Newton said, the distribution plan. We don't want, this is not something that we just want to shoot on social media, but it's definitely something that we want to put some funds behind so that it's seen and it's visible. We may even want to consider, if funding is allowable, an outside team to help us map this out. I think that making sure that it's as impactful and it does what we want it to do. We may need additional support outside of our team that we currently have here at the county that can dedicate that time to just this infomercial for this period of time so that we get exactly what we want and it's pushed where we want it to go.
I was just saying mine was not just elected officials. I'm talking about real community leaders and the grassroots community leaders, people that they trust. They didn't have to vote them in. They just trust those people, and those are the people I'm talking about involved in.
I certainly appreciate the feedback. We talked about trying to be creative and trying to find new ways to engage and utilize resources. And so this was just one of those things that I thought I would like to put out there for your consideration.
I would also like to ask, not just the committee, but if we can make sure that all council members are aware of this opportunity, and if they know of someone in their community or in their district that is a community leader and a trusted face, to make recommendation to Mr. Brown. So as we're putting this together, then he'll already have those names and contacts that we can start to expedite this process, because it's definitely noted that we know that those community gatekeepers are going to be critically important. When they can see Miss Susie Joe on TV telling them to go get the vaccine, it's definitely going to be real more impactful than maybe me telling them to do it. So if council will just reach out, if you have any faces or any names, to share that with Mr. Brown. And we're moving quite quickly to complete our agenda here. We do have our last agenda item, which is our American Rescue Plan funding. Mr. Brown, I'm going to let you loop A and B all together for you to address it this time.
Sure, and if you don't mind, I'm going to take them out of order, and I'll tell you why. On B, that really is speaking more specifically to Alvarez Glen Detention Center. Now, because the American Rescue Plan funding is the mechanism, I wanted to vocalize that with this committee first, because you're the funding mechanism. But ultimately, we're going to also go to Alvarez Glen Detention Center because the protective equipment that we're talking about and the security equipment that we're talking about is really associated with that. So for the purposes of this meeting, I'll just be general and talk about those items. I don't think anything I'm going to talk about here is something that we can talk about publicly. These are items that we already have, some of them in the facility that we just need to improve and add more. So one of the things that related to Alvarez Glen, we're looking at body scanners. That way we're reducing the number of contacts we have to have physically. So those detention officers who are engaging with those men and women who come into the facility, who currently have to put their hands on them, to touch them, to do that, this eliminates that and reduces that contact, that interaction. So you're already talking about reducing, some of that transmissibility from having to put your hands on someone. You don't necessarily know what's been on their clothes or around them or whatever the case may be. We're looking at also creating a opportunity for employees to be able to enter to that facility separate and apart from the general public. So again, that spacing, that distancing of individuals. So we're looking at doing some secured parking there. We're looking at body cameras, and I'll ultimately send this stuff to you guys as a council and as a committee in the form of a briefing document. But we're looking at body cameras as a part of that. Security equipment. We're looking at additional interior and exterior cameras as a part of that as well. So again, all this equipment will come back through Alvarez Glen Detention Center, but as the coronavirus ad hoc committee, we're going to be asking to use ARP dollars to provide these funding for safety and security equipment at Alvarez Glen. So that's what I wanted to brief you on related to item B. Item A.
Mr. Brown, let me ask you a question.
Yes, ma'am.
Does this item do we need to take any action or make any recommendation to council for this?
So I believe that you would approve the security equipment that we're asking for, but I haven't provided you anything, and I don't want to put you in a position where you feel like you're asking to approve something without seeing it. I feel confident that what we're asking for is viable and makes sense and it's needed, but I would rather you have that document so that then you could feel comfortable of what we're asking for and the money associated with it.
So you will provide the committee this information, and then we'll in return have another meeting quite quickly before of course, not before tomorrow.
Right, not before this meeting.
Before the next meeting, so that we can make a recommendation.
Correct. And that will give also the detention ad hoc committee an opportunity to review the information, to participate as well. So that's what I would prefer, Madam Chair. I appreciate it, but I think that would be a better process.
Absolutely. Thank you.
Okay, now, the other item, this is an item that actually the council has visited before, but there are two components that I want to bring to your attention. And you may have noticed we do have some of our elected officials and department heads who are on the call, because one of the things that when we brought it to the council before related to premium pay is what I'm talking about. At the time, I, as the county administrator, brought information to you and made a recommendation. Some of the feedback and conversations that I've had since then, individuals feel as though that there were options that the council did not consider, and that may be because I didn't put them before you. So I'm going to put them before you now, so it won't be a matter of the administrator not giving you options and feeling like you didn't give an opportunity to address them. So one of the premium pay items that were not included was when we came to you with premium pay, I said to you that I focused on frontline workers. At the time, it was not out of disrespect for any officials or department heads. It was not because I don't think they did a good job or they didn't deserve it. It was because I didn't want to create an issue that I thought would take the focus off the frontline workers for two reasons. Number one, the American Rescue Plan dollars, when you deal with premium pay, there's a cap. We talked about that a little bit, if you all remember. It's 150% of average median income, right? So that number for us would be $82,150. Now, if you recall, we made a decision, I'm saying I'm talking about the county now because the council approved it, to say that anybody that went over that cap, we still paid them whatever that percentage of money was, okay? So, but department heads a lot of times would be close to that cap. So that was one of the reasons why we thought, let's not create a situation where we're focused on folks that we felt like, maybe should be okay. But at the same time, because that was not considered, there are folks who feel like they were not appropriately considered. So the question before this committee today is whether or not you would like to consider the department heads and elected officials to be included in that stipend. Many of them, I shouldn't say many, I shouldn't do that. Some folks have conversed, and they are true, that they worked in person just like, other folks did. They put themselves out there, and, they felt as though they should be appropriately considered as well. So I did not exclude them to keep them from you. So that's why I'm here today, is to say, members of the committee, what is your purview as it relates to considering elected officials and department heads for the associated stipends that were previously discussed?
I will open it up for the body.
A clarifying question. And thank you, Mr. Brown, for bringing this back to us. I just want to make sure that I'm clear on something. Regarding the cap that you mentioned, the 82,150.
Yes, ma'am.
Tell me again what the rules are from Treasury on that. Is it that if you make 82,151, you are not eligible for a stipend? Is the stipend treated differently? Can you just help me understand how the cap plays in?
Yeah, so the cap plays in that the utilization of the funds themselves. So there's two pots of money, and I don't want to take you off, but there's basically two pots of money that we have associated with the American Rescue Plan dollars. There's the straight money that we receive, and then there's this calculation concerning lost revenue. Okay? So of the straight money that we received, there is a cap. So premium pay can be paid from those funds up to this cap.
Okay.
So in that given year. So ideally, if I make 8250, 150, and you want to give me a bonus from the straight money, then you'd have to come up with that dollar from somewhere else.
Yeah.
So whether that's your extra, a lost pot of money or some other dollars that we would associate with paying that premium.
Okay. So to instantiate that, my understanding, and I won't take us too far down this road, so if we can't get it with this question, I can take my answer offline. My understanding is that Richland County was to receive a total of $80 million in American Rescue Plan funding. Is that?
That's correct. We received the first part, and we're hoping to receive the second.
Right.
So, yes,
is
ma'am.
that allocation the allocation that you are referring to as the so-called straight? That's the straight funding pot to which you referred?
Right. So within that pot of money, how you can use it is based off of the actual grant, if you want to call it that, and then a calculation that you can use part of that money.
Correct.
Okay, so that's what I'm referring to.
Now, as it relates to funding from the federal government for lost revenue, is that pot of funds separate from the total $80 million funds? No, the lost revenue funds are included as part of that.
Correct.
and the lost revenue funds can or cannot be used over the 82,150.
They can be used.
They can. It's just they're separate pots. Okay. Sorry, I just wanted to clarify that. I don't want to take over for other people's questions, so thank you.
Okay.
Any further discussion about this matter? Because we do have some elected officials and department heads who want to address the committee, but I do want the committee to speak first.
Madam Chair, I thank you for being so kind, because in our committee meetings, it's generally committee doing the discussion, but Madam Chair has been kind to allow others to speak. So I thank you for that kindness, because generally we wouldn't have time to let everybody speak. So I appreciate you doing that. I guess I'm concerned with the I don't have enough time to process it in terms of what's being requested, because initially, and I made the recommendation, I think others may have agreed with it, that would be a certain amount of money, and that there would not be a percentage, to ensure that everybody was getting fair, equitable pay. I know that any time in government, they have cutoffs in terms of salaries. You know, if you make, I think if you make over $100,000, then you couldn't get the other child care money or whatever. So we have cutoffs, so that's nothing unusual. And so I want to make that point first. But in terms of giving additional funds to the elected officials of the department, I just haven't had enough time to process it, and I don't have before me how much it's going to cost anything, so it would be hard for me to make that decision right now, given that I don't have all of the information.
Okay.
Ms. Newton.
So one is, I want to ask a question. Well, first, let me acknowledge that part of Ms. McBride's comment, I mean, this is a packet with no supporting documentation, and that would be great as in terms of any determination that's being made. But Ms. McBride made a statement, and I want to turn that into part of it into a question, which was that she had at one point stated that she was in favor of amounts of premium pay that were flat amounts versus percentage amounts. My understanding is that that is what the county has done with what was previously approved. Is that correct?
That is correct.
Okay, just want to make sure that my memory is tracking. So, you know, I certainly would welcome that additional information. I will just go on record to say, from my perspective, as we look at this, most of us, I don't want to speak for every single human, were blown away by the development of COVID, the rapidity, working on trying to figure out how we needed to adapt as a county. I feel like we have exemplary staff and team members that have worked across all levels. And so for me personally, I welcome this being a conversation that we bring back, because I won't name names for fear of leaving somebody off, but really extraordinary work was done, and there were people who were in this county building every day working while I was Zooming from my home office. And so I personally welcome and would love for us to bring back this conversation, because, again, we want to stay absolutely within what our federal guidelines are, but there were people across the entire wage scale who did extraordinary work in uncertain times, and I would just love for us to recognize that.
I do echo those same sentiments, that we do anticipate being able to bring this back before this body, so that we can have we can make an informed decision on this, and noting that there's lots of people that did a lot of work, and they're still doing a lot of work. But at some point, we have to make a decision as to how we implement this. Right now, we have a plan in place that we did vote on, and we're open to exploring perhaps another plan. But I think we need to have the details. We need to have the details before we can do so. I see the auditor has his hand raised. Mr. Brawley, I'm going to open the floor up for you And as Ms. McBride has said, this is not a normal tradition, so I would ask that you would limit your comments, and so that we can continue on with our agenda. Mr. Brawley, you're recognized.
Thank you, Madam Chair and council members. I had my hand raised for the infomercial component of it, and I'd also like to speak a little bit to the premium pay. But for the infomercial, my office, we send out probably between 25 and 30,000 automobile taxes each month. And I think that would be an excellent opportunity for council members or the county to insert something as it relates to getting vaccinated. When real estate bills go out, a lot of young people may not own real estate, but most of them own an automobile. And when they get the car taxes, they have to pay that so that they can get their renewal sticker. So I think that's an excellent opportunity for us to insert information that would be very good for our community to take note of. I think on the avenue of premium pay, I logged in because a great deal of my employees, probably about half of them, telecommuted and also came into the office depending on what day and what time of the month it is, because, you know, of course, we generate over $800 million of taxes for the county, and all of those tax bills had to go out. But we had to make a decision based off of what was given earlier for premium pay that I think left out a lot of my employees that have worked diligently in terms of trying to make sure that we still stayed on term. And I'd just like for council to consider another premium pay option for those employees. Thank you very much, Madam Chair.
Thank you, sir. Solicitor Gibson, you're recognized, and if you would, please limit your comments as well.
Yeah, will do. Again, thank you to everybody for allowing us to be on this call. I'd just like to echo what Mr. Brawley just mentioned. I mean, I've got several of our employees, you know, I'm not advocating for myself. That's not why I'm having this conversation, but many of us came in every day, and there's some who came in probably 3 to 4 times a week because we have so many. We thought it would be irresponsible to bring them all in at one time. So they telecommuted, they worked from home, you know, maybe 2 days a week. We're here 3 days, or sometimes 4 and 1. And I think that I'm sure that many of them, some paralegals as well, many of those went above and beyond as well. So, you know, first of all, thank you for considering it. But, you know, as this is, anytime that you offer, you know, any amount of money that's out there, then there's a group of people there's an unrest that's created because, you know, there looks like there's a delineation. So for us, many people came back irritated and thought that we personally made decisions that prevented them from qualifying for monies. And so if there is a way for others who, you know, went above and beyond to be compensated in some way, shape, or form, I'd love to see that. Second, just had a general question, and you guys may take this up without me being on, I'm not sure, but I'm not sure if I understood what you were saying when it comes to the lost revenue aspect of it. Was lost revenue being looked at on the premium pay, or lost revenue as an additional pot of money where we may be able to petition for additional monies because we were not able to collect revenues like court fees and fines, which is we had a significant dip in our in monies that we were able to secure that we normally would have secured if we had court, because we could not collect fees and fines for almost a year. Those are my comments, but thank you again.
Thank you. And so I will allow Mr. Brown to address, well, I can address it. I'll address it. The lost revenue is not pertaining to your department. This is as a county. This is overall as a county. These funds came from the federal government. So that's not the item in which we're looking to explore the option of replacing monies or funds that were lost in a particular department's budget. That's not what those items are for. Mr. Brown, is there anything further you need to add to that?
Not to that statement, Madam Chair.
And please you have another statement you'd like to add,
I was
please?
just going to say to what Mr. Brawley said and Mr. Gibson said, is that one of the things that we were going to bring to the body, and I'll give you this in the briefing document, is we did get a lot of folks who talked about the fact that, you know, they worked some remote schedule, some in-person setting, and then some out of the office setting. The stipend that was paid, and I want to be very, very clear about this, the stipend that was paid to individuals who worked in person, just like they were working in person before the pandemic hit. So in giving examples to individuals, there's been a lot of folks trying to determine and talk about their scheduling and all of that. And the reality of it is, unless and this is a big if, but unless your schedule changed, like you started working a different schedule and you would work that same different schedule forever, basically, that's your new schedule, then we're talking about your regular in-person work. Not if you worked in person 3 days and now you did 2 off or 4 and 1, and it's not about how hard you worked or whether or not you worked at all. That's not the question. So the third thing we're going to come back to this group with is to address specifically what Mr. Gibson and what Mr. Brawley and others have said, and that's, does this body want to provide a level of compensation in the form of a stipend for individuals who did work in person some days and remotely for others? So what we're going to do is we're going to give you a document. The document is going to simply say, what we're talking about now. And what we would say is, if we're going to do that, then we want to be what we consider to be equitable, or my recommendation would be, we did 5 for like your EMS, your law enforcement that were out there in the field. We did 2,500 for office staff who was coming back in person, and then where we have this, remote and in person, I would again half that number, and so you would take that 25 and you would do 1,250. So that's what we'll be coming back to you with. I will put that before you as a body. I don't have an issue with that. It was never about not addressing individuals who worked remotely. It was that at the time we were dealing specifically with what we understood from the American Rescue Plan, and as we still understand it, that you can utilize funding, but that funding has to be used to pay for in-person services. So that's why we feel confident that if we do 1,250, that we would not run afoul of any issues, because we believe that we could substantiate that with somebody's routine level of pay over the course of the period of time. So, but again, not asking you to vote on that now, but there were a lot of individuals. I'm not saying it was every official and every department head, because that's not the case. But what I wanted to do, and we talked about this many times, it's important that we have these public discussions so people believe and trust that we're willing to have these open dialogues, and there's nothing that's happening without public discussions. So again, but those were 2 separate items, whether or not you include department heads and whether or not you do this other level of pay will be 2 different considerations that will come back before the body, but certainly wanted to get this on the agenda as soon as possible, because we had members who were really concerned that you hadn't considered this.
Thank you so much, Mr. Brown, for bringing this before the body for us to discuss, and we will definitely take it up in more detail at our next meeting. Our next item on the agenda, if there's nothing further, is adjournment.
So move, Madam Chair.
Second?
Ms. Only, or Ms. Black?
McBride?
Yes.
Livingston?
Yes.
Barron?
Yes.
Newton?
Yes.
Motion passed.
Thank you all. Have a good afternoon.
Thank you.